Hey, I'm Chinonso Opara, and I'm here to talk to you about 5 ways to reduce the risk of bone fractures in older adults. So, if you are an older adult, or if you know an older adult, this video is just for you. Our bones stay healthy through the normal process of remodeling that constantly removes older bone and replaces it with new bone. As you can see, this picture illustrates what normal bone looks like. However, bone loss takes place when this delicate balance is impaired, leading to more bone removal and less bone replacement. This imbalance happens with menopause and also as we all age. And it is this imbalance that can lead to osteoporosis, as is seen in the picture next to normal bone. And osteoporosis is the most common bone disease in humans, and it is characterized by deterioration of bone tissue, disruption of normal bone architecture, and this leads to low bone mass and compromised bone strength. Now, all of these factors increase the risk of fractures. So, how do fractures impact society, and why should you care? So, hip fractures are associated with as much as 35% excess mortality within 1 year. And once you have a hip or back fracture, your risk of another fracture is increased as much as 5-fold. And annually in the US, there's approximately 2 million fractures attributed to osteoporosis. That makes for about 3 million medical-related visits. Now, how do we get this number? First of all, there are about 2.5 million medical office visits due to osteoporosis-related fractures, and 500,000 hospital admissions, and 200,000 nursing home admissions. So especially as our population is aging, the medical cost of these fractures is expected to rise by 2025 to more than $25 billion. So what can you do to reduce your risk of fractures? The consumption of calcium is required for the acquisition of peak bone strength and also for the maintenance of bone health. Our bones contain 99% of the calcium in our bodies. That's right, 99%. And when we don't eat enough calcium, our body steals this calcium from our bones and redistributes it to other organs that also need calcium. The Institute of Medicine recommends 1,000 milligrams of calcium per day for men between the ages of 50 and 70 years old, and for women between the ages of 50, for women older than 51 years old, and men older than 71 years old, the Institute of Medicine recommends 1,200 milligrams of calcium per day. While low-fat dairy products are rich in calcium, you can also get calcium from fruits and also from vegetables. For example, leafy greens, soybeans, and oranges are especially packed with calcium. However, calcium supplements should be used when an adequate dietary intake cannot be achieved. Now, vitamin D is necessary for the absorption of calcium, and so therefore plays a major role in bone health. Vitamin D is made in our skin from the ultraviolet light from sunlight. However, because of concerns for skin cancer, variations in climate, and just the realities of modern life and work, most people need to get vitamin D from other sources besides sunlight. and this means from diet and from supplements. So the National Osteoporosis Foundation recommends 800 to 1,000 international units of vitamin D each day for the general population. And foods that are rich in vitamin D include vitamin D fortified milk, cereals, and saltwater fish. Vitamin D supplements can, however, be used if dietary intake is not sufficient. So weight-bearing and muscle-strengthening exercise include walking, running, stair climbing, dancing, weight training, yoga, and much, much, much more. They improve agility and strength, and they also improve posture and balance. This can potentially reduce the risk of falls. Also, by stimulating the vibration sensors in bone, exercise can directly increase bone mass. Because the benefits of exercise are lost when people stop exercising, physical activity should be a regular, lifelong habit. Now, while there are many different potential exercise regimens, the best one is ultimately the one you do. Now, since the majority of osteoporosis-related fractures results from falls, it is important to recognize what these risk factors for falls are. And some of these factors include dehydration, muscle weakness, and problems with balance and vision. Other major risk factors include slippery conditions, particularly conditions found in the bathroom. These risk factors can be addressed by staying hydrated and engaging in regular physical activity, as previously mentioned, which helps strengthen our muscles and improve our balance. And if you have trouble getting around, you should consider using a cane or a walker. You should consider getting your eyes checked regularly in order to optimize your view of your surroundings. Also, there are a number of bathroom assistive devices, such as toilet safety frames and shower mats, that can help prevent a slip in the bathroom. Also, smoking, as well as having more than 2 alcoholic drinks per day, further tilt that balance of bone remodeling towards increased bone removal. And smoking decreases calcium absorption, which further weakens bone. And excessive alcohol increases the risk of falling. So to optimize your bone health, do not start smoking, and if you do, you should think about quitting. In fact, the National Osteoporosis Foundation strongly encourages a smoking cessation program as an osteoporosis intervention. Lastly, think about not consuming more than 2 alcoholic drinks per day. So, in review, during menopause and as we all age, a shift in bone remodeling takes place where there is more bone removal and less bone replacement. This can potentially weaken bone to the point of osteoporosis, and osteoporosis dramatically increases our risk of fractures, which leads to excess mortality. This costs our healthcare infrastructure billions of dollars each year. However, there are 5 things you can remember to reduce your risk of fractures. Make sure you are getting enough calcium and vitamin D and physical activity. Also, recognize the risk factors for falls and mitigate them as much as possible. And try to avoid smoking and excessive alcohol. While these are 5 things you can remember to reduce your risk of fractures, it is important that you follow up with your doctor for regular health maintenance.